long. Where it's not nearly this hot.
Okay, so let's see. Surgery was 2001.
Yes.
And you're a nurse midwife?
Yes, I'm a nurse midwife. I deliver babies. So.
Right. And can we? It's kind of personal. You weighed how much? Then?
The day I had surgery, I weighed 334 pounds. I lost 152 pounds in the first 12 months. I lost probably another 25 or 30 pounds in the next 6 months after that, but I had a hysterectomy, a tummy tuck, and mono all in the course of about 6 weeks.
So I don't get credit for the mono.
Don't get credit for just the very end of it. And I did, you know.
Wait, I just want to mark a spot here. We're going to edit that part out. So the total.
But so I got down to kind of a lowest point, and then rebounded just a little bit. Rebounded up about 20 pounds from what my lowest point was. So.
Good. And have done fairly well otherwise?
I have done so well that I've brought every member of my family so far who needs to come. My brother being the next one that's going to come. I brought my sister will be 3 years post-op in November. She's lost about 230 pounds. I brought a cousin who lost about 130 pounds. My best friend lost about 130 pounds. So we've all done outstandingly well and really just had minimal post-operative difficulty at all.
Now, your sister, though, had a leak after her surgery, which is a terrible complication.
She did.
And we need to recognize that. Fortunately, leaks are pretty uncommon. And also, your sister was a little bigger than average.
She was.
A little sicker than average. And we feel bad about her complication of having a leak. On the other hand, we identified it 2 or 3 days after surgery.
The very next morning after we went home from the hospital.
Right, and then we brought her back in. We were able to put a stitch in it, and a couple of days, and some antibiotics, and she's done well subsequently.
She's been excellent ever since, and she... Oh, that's what I was going to say. If he tells you that something's up, she didn't want to come back to the hospital.
Yeah,
she didn't want to go back into surgery.
She's
very
a pediatric ICU.
She's a NICU nurse.
And neonatal ICU nurse. So after surgery, most of you should feel great.
Yes.
In other words, some aches and pains and like a bad cold and kind of puny, but generally great. And she felt bad and had pain, and so when I talked to her and Sarah on the phone, I said, come back to the hospital. And she said, well, I don't want to. And so, but fortunately, I've been married. I know how to deal with women who say no. Not very well, since I'm not married anymore. But we kind of fussed with her, and we were a little bit forceful. But basically, if you have a leak, you hurt a lot more. And instead of getting better after the first wake-up after surgery, you gradually get worse, and you feel worse. So a leak hurts a lot and gets worse. Your surgery hurts somewhat and gets better.
What kind of hurt is it?
What kind of hurt?
Yeah, is it like a cramp?
It's like being shot with a gun.
Mm-hmm.
I wouldn't know that.
It's like being stabbed with a spear.
Is it like an appendicitis attack?
Worse.
Worse, yeah. It was so dramatically different than the experience I had because I never, from the time they discontinued my pump in the hospital, I never took any pain medicine after my surgery. And I was a little sore. It felt like I'd been doing too many sit-ups, just kind of a muscular soreness. Maybe had to kind of be easy when I turned over in the bed that I didn't go too fast because it pulled a little. That was it. And she got progressively worse, sicker, miserable, couldn't get out of bed, couldn't stand up, couldn't walk to the bathroom.
And even in that condition, she still said, oh, I don't want to come back to the hospital. And I think, again, we hate to have a leak, and we hate to talk about a leak, and it's possible this video won't make it to the webcam. This is a good one. But the interesting thing about our leaks is it's terrible. It's a terrible, 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 terrible complication. But it was pretty easy to identify. As soon as they called and started talking to me, I go, oh, come back. Because we knew kind of right away what it was. The other thing is we didn't do any tests. We didn't do a CAT scan or an upper GI or an endoscopy. We just said, we're going to reoperate. And with the laparoscope, reoperation is nothing more than sliding the little TV camera back in. And since you're asleep, it's actually much less annoying, uncomfortable, painful than a CAT scan or even a plain x-ray. So we saw her in the ER and said, yep, you're going to have surgery. And she fussed a little bit more,
You
right?
said it'll take 11 minutes for me to look.
Yeah.
11 minutes for me to look, and if it's fine, go back to the hotel room.
Right.
And if it's not fine,
We'll
we're
put
going
a
to save
stitch
your
in.
life.
Yeah. And we did, and it put a stitch in, and she did great. So one of the nice things about our surgery, it's very, very different than the other kinds of open surgery. Good morning.
Good morning.
Come on in. It's very easy to identify a problem. Fortunately, our rate of those problems is extremely low, and when they happen, they're real easy to identify and usually easy to take care of.
But then, Dr. Rutledge, I was so worried because I scraped all the money together. I was worried, I hope I don't have any problems, because it's going to cost more money.
Right.
How do you get charged for that?
Well, what we wish for is that we could give you an answer that could be published on the internet so I could tell you that it would be easy to take care of. But I'm going to interrupt the video here for just a second and tell you that